Hello everyone, I am Dr. V. Mohan and I want to thank you all for joining this special show. I'm sure you all know why this show is special, and I hope all of you know that November month is called as the Diabetes Awareness Month. Now, why is November called as Diabetes Awareness Month? I'm sure you know that also, because November 14th happens to be World Diabetes Day. Now, do you know why November 14th is called World Diabetes Day? The reason I'm asking this is this morning I was talking to several children with type 1 diabetes, and I thought they will all know this answer. And I was very surprised that very few of them actually knew this. So, World Diabetes Day is being celebrated because of the discovery of insulin by Frederick Banting, Dr. Frederick Banting from Toronto in Canada. He is the one who discovered insulin, and that is why everyone with type 1 diabetes, especially children, are alive today. And his birthday happens to be on November 14th. Quite coincidentally, November 14th is also Children's Day in India because it's also the birthday of Pandit Jawaharlal Nehru, our first Prime Minister of India. But this November 14th is very special to India because we have many new things to tell you for World Diabetes Day. So I thought I will reach out to all of you all today. And I'm aware that all of you in different platforms have joined, including YouTube and Twitter and all the other Facebook and everything, Instagram. So if you have any doubts, please type it in the chat box or in the comment section, and I will try to answer as many of your doubts as possible. Now, let me give you some statistics. Firstly, the number of people with diabetes in India has gone up considerably. Some of you may know that in June of this year, we published the largest epidemiological study perhaps done in the world on diabetes. That is, the whole of India was sampled using a representative sample. More than 1,13,000 people were selected to represent India's 1.4 billion people. And then we published the results in the famous journal Lancet Diabetes. So we found that 101 million people, that is 10 crore people, have diabetes in India today. Another 136 million people, that is 13 crore people, have pre-diabetes, the stage before diabetes. That means they are also going to develop diabetes quite soon. So you add those two, and it becomes 237 million people, 23 crore people. Now, some of you may not know that there are very few countries in the world, out of the 200, 250 countries in the world, there are very few, probably 3 or 4 or 5, which have more than 200 million population itself. Okay, population itself, having the whole country having population of 200, 250 million people is very rare in a country. And in India, we are having that many people with diabetes and pre-diabetes. So you can imagine the scale of the problem. In other words, it's about 10 times Australia's size. 10 times Australia's size. Probably about 4 big countries in Europe put together. If you take the population, Germany, France, UK, if you add all that together, you will probably get the number of people with diabetes and pre-diabetes in India. So we are having a huge problem. But we are not worried just about the diabetes itself. What we are more worried is that people are developing complications of diabetes. So they are developing kidney complication, eye complication, heart complication, nerve complication. The nerves, when they get affected, you lose sensation in the feet, blood circulation gets affected. That leads to amputation of the leg, blindness, kidney failure, heart attacks, stroke. And today, we know that there's a new complication affecting the liver. Diabetes can also affect the liver. It produces a condition called as non-alcoholic fatty liver disease, also recently called as metabolic associated fatty liver disease, or MAFLD, earlier called NAFLD. and this can progress to cirrhosis and even to liver cancer. So this is diabetes, another cause for that. Almost 50% of people with 50% of all diabetics have fatty liver disease, and if you have diabetes and obesity, it's almost 80%. So these are very frightening statistics. So to prevent all that, we are actually inaugurating at our center on November 8th, as you'll see at the bottom of the screen, a novel diabetes liver clinic is being established. A liver specialist is also joining us, Dr. Ashwin. And we are setting up special equipment for that, like fibroscan and all that, to assess the liver. And we are we already have diabetic eye unit, foot clinic, nerve clinic, heart clinic, all those things we have. Now we are setting up a diabetes liver clinic also. This will be the first time in India that we are doing this. And I'd like to inform you about this. And this will be first set up at our Gopalapuram main hospital in Chennai. Now, all diabetes is not the same. I'm just going to give you a few messages, a few important things which you should know. And then I'll take questions from all of you, if that's okay with you, right? I'll give you plenty of time to ask questions. Don't worry. Now, all diabetes is not the same. So about 90% of all people with diabetes have what is called as type 2 diabetes. So if you don't qualify and just say diabetes, we're talking about type 2 diabetes. Okay. But remember that not everybody has type 2 diabetes. Type 2 diabetes can be controlled with diet, exercise, weight reduction. It can even be reversed in some cases. We call it as a remission of diabetes. So all that is possible in the case of type 2 diabetes. There's another type of diabetes called type 1 diabetes. Some of you would have heard about it. Usually occurs in children. It can occur at any stage of their life, actually, any ages also. And this type of diabetes, there is total insulin deficiency. There's no insulin at all in the body. So what happens is, all people diagnosed with type 1 diabetes, particularly children, have to take lifelong insulin injections, not once, not twice, not thrice, but 4 times a day. And unless you take that insulin, your life is in danger. If you stop the insulin, you can die. That's what happened 100 years ago, before insulin was discovered by Banting and Best and MacLeod and others. All children died within 1 week, 2 weeks, 1 month after diagnosis. Today, they're able to live up to 50, 60, 70, 80, even 90 years of age by taking this insulin. Okay, so that's type 1 diabetes. There are other forms of diabetes as well. There is a type of diabetes where stones come in the pancreas. It's called fibrocalculous pancreatitis. Pregnancy can produce diabetes. It's called gestational diabetes. Then, even among children, not all children who are diagnosed have type 1 diabetes. You may think all children are usually treated as type 1 diabetes, but it need not be that all children have type 1 diabetes. You can have type 2 diabetes also coming in children. They'll be very overweight, obese. In the neck, they'll have a sign called as acanthosis nigricans. And then they have dyslipidemia, and they'll have a family history of diabetes. Both father and mother will have. That is type 2 diabetes. But you can also have other forms of diabetes. For example, there is a condition called as maturity onset diabetes of the young, MODY, M-O-D-Y. It's also called as monogenic diabetes. This can occur even in a newborn child. It's called neonatal diabetes, just after birth. Now, these forms of diabetes, you have neonatal diabetes or MODY type diabetes, M-O-D-Y type of diabetes. You'll be wrongly treated as type 1 diabetes. But if you come to us, we'll do a small genetic test. And with the genetic test, we can find out whether you really have type 1 diabetes or not. And if you don't have type 1 diabetes, you actually stop insulin and put you on tablets. And these children, for them, it's like a miracle. We have had hundreds of such children in whom we have been able to stop the insulin completely and put them on tablets. We can't do it with type 1. I must tell you, if you have type 1 and then you come to me and say, you said you can stop insulin. I can only stop insulin if it is not type 1 diabetes. And for that, we can help you to do the test and find out which type of diabetes. If you really have type 1 diabetes, you have to take lifelong insulin only. But for that also, we have got better methods of treating it. We have got newer insulin pumps now, which are almost like an artificial pancreas. So it will find out your blood sugar, find out how much insulin you need, and it will automatically give you insulin. It's like a plane without a pilot, how the plane will go. So like that, it has already come. You just wear it and it will do everything for you. So that is called an artificial pancreas or hybrid artificial closed loop system, we call it. the correct name for it is like an artificial pancreas. So that is also possible. That has come. Almost 200, 300 of my children have switched over to this pump, and they're doing really well. Then all this high sugar, low sugar, all this can be prevented. Now, I have been in this field for about 50 years, more than 50 years. When we started, we didn't even have this glucose meter to check the glucose. We had only urine sugar. You had to take the urine, heat it, boil it, then put urine in a, put some, copper sulfate solution type thing, Benedict solution, again heat it, see whether it changes color. All these things we had to do. Now, then came glucose meters, where you have a small glucometer. Earlier, the glucometers are very big, very inaccurate, very, difficult to do. You have to wait for 3 minutes, 5 minutes. Today, in 5 seconds, you can find out the blood glucose level. Now, we have gone one step further. We have this small patch like a coin. Put it on your hand, and it will automatically read the blood sugars without drawing one drop of blood. That's called CGM, or continuous glucose monitoring. And it will tell you 100 blood sugars in a day without taking one drop of blood. So that has also come a few years ago, and we are now routinely using it in treatment of all our patients. In fact, we don't even treat a patient until we know about the continuous blood glucose level. It's like a video monitoring. So if you take a photograph, now I'm talking now, you're seeing a video, isn't it? You can see my hand moving, everything you can see. Now suppose it just took one photo, it'll be like this. Isn't that different from watching me talk and so on? So that's the difference between a photo and a video. Similarly, blood sugar, if you take only one time, you'll get that one picture like this, one picture. Whereas if you take the continuous glucose monitoring, you can see it throughout the day. It's not very expensive also, and gives you so much information. This helps people to fix their tablet dose, diet, exercise, and everything. And it's made, this is what you call as precision diabetes, okay? Finding out which type you have and then giving you treatment for that. Now, when you talk about type 2 diabetes, all type 2 diabetes is not the same. You can have a thin person with type 2 diabetes. You can have a very fat person with type 2 diabetes. You can have people who have very little insulin, people who have a lot of insulin in the body. Those have insulin resistance. Why I'm talking about this insulin resistance and all that? In social media, there are people who are going and saying that with only insulin resistance is the cause of diabetes. Okay. And therefore, everybody must just focus on insulin resistance. All kinds of fads, they say, just test your insulin level. That is the latest way of treating diabetes. That's all bunkum. Don't believe them. Diabetes is not of one type. Okay. There are different types of diabetes. Very lean people will be there where there's very little insulin resistance. Most of it is insulin secretory defect. So there, they may need insulin earlier, or they may need tablets to secrete insulin more. Because I've seen social media videos saying you should never give a tablet to stimulate your pancreas. Who said that? If your pancreas is not working properly, you will have to give tablets to stimulate it. On the other hand, there are people who are very obese or overweight, where they're already having too much insulin. There you go and give a tablet to stimulate the insulin, you will be producing too much of insulin. It is not good for you, isn't it? There you need a drug to make that insulin work properly. And there are tablets like metformin and other drugs which can help you to control your diabetes well. Where I'm coming to is, treatment of diabetes is not one size fits all. You can't just give one treatment for everyone who comes to us. If I see 100 patients in a day, those 100 patients can be 100 different types. Okay. And each patient you have to treat in a different way depending on that person's individual characteristics. That is what we call as personalized diabetes care or precision diabetes care. That is exactly what we do at Dr. Mohan's Diabetes Specialty Center. People ask, what's so special about your center? That's what is special about our center. Each and every patient, we find out what type of diabetes you have and then give you the treatment that is correct for you. And that is why it takes a little time for us to study you. And that's why we do some extra tests to find out what you have so that we can give you the precision treatment. Okay. So these are days of precision treatment. So I already talked about, the diabetes complications free India. Now, we know that people have diabetes. And as you grow older, as your lifespan increases, or if your father and mother have diabetes, very difficult to prevent diabetes like that. You can, of course, prevent it by weight loss, and you can even reverse it and so on. But in many people, the diabetes will still come because the family history is so strong and you have little obesity and so on. So diabetes will come. So what we have to do, of course, number one, try to reverse it if possible. This reversal is possible or remission is possible if you have overweight, short duration of diabetes, milder diabetes. Then with a calorie restricted diet, by cutting down on calories, you can try to control diabetes and reverse the diabetes, go back to pre-diabetic stage or normal glucose tolerance stage. But suppose you are crossed that stage and you're not able to reverse the diabetes, don't worry about it, because we have got patients who have had 50 years of diabetes, 60, 70 years of diabetes. They have crossed 100 years of age. They are today 102, 103, 104 years old, and they don't have any complication. They've lived their full life. Their brain is intact, the body is intact, everything is intact. They're having a fantastic life. They're having a better life than a person without diabetes. So why do you worry? Why do you worry? Oh, my diabetes is not gone away. So what? You can still live with it and better than a person without diabetes. In fact, I would go as far as to say that if you have a little diabetes, you can actually have a longer life. Why? Because you will be careful with your diet. You will do your exercise every day. You will check up your sugar, BP, cholesterol, and all that. You will go for a checkup every day. That last one is very important, because unless you go for a checkup to the diabetic clinic, come to us every 3 months and we'll check it. So if it goes a little out of control, we'll bring it down. Again goes out of control, we'll bring it down. Again goes out of control, we'll put it down. If you don't do that, it'll keep going up, 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 up. One day some eye will give problem or kidney will give problem. Oh doctor, now my kidney is affected. Please help me. We can't do anything at that stage. It is very difficult to do anything, isn't it? So prevention is better than cure. So keeping your diabetes under good control, coming regularly for the checkup. Don't think that only if you have symptoms you should go to the diabetic clinic for checkup. Don't wait for symptoms to come. Diabetes is an asymptomatic disease. We call it a silent killer. From behind, if somebody comes and snake comes and bites you, snake is going to come with, not with an alarm on the top. No, hey, I'm a snake. I'm coming to bite you. It doesn't tell you like that. No, it'll come and bite you. Then only you realize a snake was there. Similarly, diabetes will catch you by surprise. Suddenly it will come and suddenly you will find kidneys affected, something. But the good news is you can prevent all that. We are now finding that our patients are living longer and longer. They have no complications whatsoever. And since we have 50 years experience to back it, and we have more than almost 1 million patients now have been touched by us, and almost 600,000 of them are being followed regularly. So we are able to say that, yes, we can assure that you will not have any complications and have a long and healthy life. Once a year, make sure that your eyes, kidneys, heart, feet, and now liver, also nerves and liver, all need to be checked up. Also see that you keep doing some monitoring, either using CGM pads, the continuous glucose monitoring, or this one at home. If possible, if you have a BP machine, you can check that also at home. Okay, and give all the data back to us, because we want to know what's happening to you. It's not important that we see you once and after 1 year we see you. In between, we don't know what is happening. Diabetes is a lifelong disease, and we need constant interaction with you, and we are happy to provide that. We've got apps now. We've got a Diala app, what we call it. So once you're connected to us, 24/7, you can be connected to us. All your data can come to us. We can give you information. We can tell you what is happening, what is the latest happening in diabetes, what else needs to be done. You can send your reports to us through email, we'll respond to you, or through telephone, we'll respond to you, or through video, we'll respond to you. There are many ways in which we can keep in touch with you, not necessarily only physical coming and sitting in the clinic and doing that. COVID-19 taught us that there are many other ways of approaching medicine, and particularly diabetes patients. So I talked about diabetes. I talked about the numbers. Let me talk about another condition called pre-diabetes. Now, what is this pre-diabetes? Pre-diabetes is a condition before you get diabetes. So let's say normal is here and diabetes is here. Okay, so normal is here and diabetes is here. In between, there is a condition called as pre-diabetes. Now, the condition called pre-diabetes is very important, because if you don't diagnose it there, you will progress and you will become diabetic. Now, if you have pre-diabetes and at that stage itself you start some dietary measures, start exercising, sleep properly, and do all the right things, you can reverse the diabetes also and become like a normal glucose tolerance stage. What you were 10 years ago or 15 years ago, you can go to that stage. That's like gaining 15 years of your life. To gain 1 year of life, what all we'll do? Like gaining 15 years of your life. Just imagine. So that is also possible. So remember, there's a condition called pre-diabetes. Now, whom should you check for pre-diabetes? Anybody in the family, if they have diabetes, your father, mother, brother, sister, grandfather, anybody, uncles have diabetes, some gene is passed on to you. And therefore, you should go for the checkup. Now, if you have diabetes, then your children are at risk, or your brothers, sisters are at risk. Bring them, we'll check them also, and we'll tell you whether they're in the normal stage, pre-diabetic stage, or diabetic stage. If they're normal stage, we'll help you to stay there and not progress. If you're in the pre-diabetic stage, we'll help you to reverse it and not go to diabetic stage. If you're in the diabetic stage, we'll help you to reverse it and come to either pre-diabetes or normal, or if it has gone beyond that stage, at least to stay there and not to go to the stage of complications. So it is my dream, and I've been saying this on all World Diabetes Day occasions. I've been saying it for the last 3-4 years consistently, because that is a theme which I want to impress on you today, that India may have 100 million people with diabetes. Doesn't matter. But we should not have anyone with diabetes complications. That's very important. And therefore, we must prevent all the complications of diabetes. There should be no blindness due to diabetes. Nobody should have kidney failure due to diabetes. Nobody's leg should be cut off due to diabetes. There should be no heart attacks due to diabetes. Okay. And there should be no liver problem due to diabetes. You go and drink and get liver problem, that's a different thing. But with diabetes, you should, therefore you should not drink, and you should not drink too much, and you should not get liver disease due to alcohol also. But diabetic liver disease prevent. Impotence. Many men and some women also have sex problems. They cannot have intercourse because they have erection problem, their nerves are affected. That also can be prevented by good control of diabetes. So remember that all these complications can be prevented. And why we are coming out to you and talking to the public is, otherwise only those patients who come to me I'll be able to address. I will not be getting the bigger picture. I won't be able to tell everybody in India or everybody in the world about what is to be done. But through these channels, I'm able to reach out to many of you who have never seen me, who have not are patients at all. It doesn't matter. But let's make India diabetes complications free. That's what is being scrolling down now. Let's make a diabetes complications free India. It is possible. I believe it is possible. Not only India, world. Let's make a diabetes complications free world. Why India only? Everyone in the world should be diabetes complications free. That is my dream. That is my hope on World Diabetes Day. Okay. So what I'll do is, there may be specific questions which you all are asking. And so we will take up those questions first. And if there is anything else which I need to say, I will say it. I want to give enough time to answer your questions. So let us start with the questions. If they come up on the comments screen, I will take it up. My team is there. Can you put up some of the questions? So while they're putting up, okay, here is Vijaya G is asking, if I was diagnosed with type 2 diabetes and I subsequently control sugar with good diet and exercise, do I still need to take medicines for diabetes? Vijaya, I'm happy you asked this question. Now, everybody has this particular thing, because this has been promoted 20 years ago or 30 years ago. Nobody asked me this question. If I told them, see, you've got diabetes, you follow this diet, you take this exercise, and then you take this medicine, they took it. Okay, 30 years ago, I've been 50 years earlier, I started my practice and I was treating people. So first 20, 30, 40 years, nobody asked. Today, everybody is asking this. Should I take medicine? Isn't it a bad thing to take medicine? What is a bad thing? I just told you that type 1 diabetes, if you stop insulin, you'll die. Is that better than taking insulin? Similarly, type 2 diabetes also has a natural history. It's not that I told you from normal to pre-diabetes to diabetes to complications. That is a whole natural history. Now, when that is there and you're already in the diabetic state, the next stage is prevention of complication. What is your main aim in life? Just like I've written here, let's make diabetes complications free world, I've written. Like that, let's make diabetes complications free for you. You have to start with you and your family, and then go to society, and then to the India, and then to the whole world. So you must be diabetes complications free. For that, 3 things you have to, A, B, C, D, actually 4 things you have to do. If you follow the A, B, C, D mantra, Okay, you can be diabetes complication free. What is ABCD mantra? A stands for A1C or HbA1c, glycated hemoglobin, glycosylated hemoglobin, A1C and HbA1c all are same. It should be below 7%. Normal value is 5.6. To expect 5.6 in a diabetic person with diabetes is very difficult. We are given a little margin and we are saying, all right, you can go up to 7, 6, 6.5, 8, 7, 6.8, 6.9, 7. Okay. If you keep it below 7 HbA1c, you will not develop complications of diabetes. That has been shown. Okay. Next is B, blood pressure. Blood pressure has to be kept normal. For your age, there is a normal. We give one figure 140 by 90, but actually it should be 130 by 80 or below. If we keep it 130 by 80 or below your blood pressure, your B box is also ticked. Now we come to the C box. C is what? Cholesterol. So there is something called good cholesterol, bad cholesterol. Don't believe this Google university and WhatsApp university. They're all lie university, I'll say. They're all lying. Okay. So they will tell you there's nothing called cholesterol, there's nothing called bad cholesterol. They're all making it up. They're all pharma, which is selling it. Don't believe a word of what they say. There is something called as bad cholesterol. And if your bad cholesterol is high, your risk of heart attack is very, very high. Okay. I'm a firm believer in that. So there is something called cholesterol, and cholesterol, too much of, you need some cholesterol for the body. I agree. But if you have too much of it, it is going to produce strokes and heart attacks and all kinds of things. So you must keep your cholesterol under control. For that, if necessary, you can take medication. Otherwise, by diet, exercise, you can control. So your C box is also ticked. A is HbA1c, ticked. B is blood pressure, ticked. Now C is cholesterol or bad cholesterol, LDL cholesterol is also kept under control. That's also ticked. Now D. D stands for discipline. Okay, that includes some diet control on your part, some exercise on your part, sleeping on time is very important, doing some regular checkup. I told you, doing with either glucose meter or the patch, doing that, going to a lab and checking your sugar, fasting, cholesterol, urea, creatinine, HbA1c, lipid profile and liver function, all that once a year, checking your eye, kidney, heart, feet, that is all part of your discipline. If you follow this A, B, C, D mantra, you will not develop complications at all. But to answer Vijaya's question, do you need to take medication? Well, that depends. Sometimes you may not need. And we will also tell you, Amma, your sugar has come down now. Let us reduce the dose of medicine and see. We reduce it. After 2 months, you come. Still, the sugar is going low. Now time has come to stop medicine. But once you stop medicine, it doesn't mean next 50 years you don't need medicine. Maybe after 3 months, 6 months, sugar may go up and you may have to restart the medicine. Okay. So if the doctor says, after studying, if a scientific doctor who is doing precision diabetes, precision medicine, personalized diabetes, he is studying and saying, Amma, without your medicine, you're not getting under control. You're not getting that 7, you're getting 8, and you're getting 9 in A1C. You're going to develop complications. So why don't you take the small tablet and keep it under control along with your diet and exercise, not instead of. Along with your diet and exercise, you take it, then you are under good control. So if you need medicines, take it. Now, immediately, maybe Vijay, you will ask me, but if I take medicine, I'll get complication. Another myth, which is propagated by social media and WhatsApp University. Okay. Oh, if you take medicine, you will get complication. Show me who developed complication due to medicine. I'm not saying all medicines are safe. I'm not saying that medicines will never produce complication. I am saying that regular patients who take regular doses, small doses of medicines, those medicines are 100% safe. And therefore, if you need to take it, you should take it to keep it under control, because you've got a disease. And that's why you're coming for treatment. You're not a normal person on whom you're giving tablet. You're a person who has got diabetes, not under control. We have got the threshold, 7%. We want you to keep it under control. You have not kept it under control. You're not able to get it under control. So we are giving you medicine. And we are going to study you after 2 months, 3 months, decide whether you need medicine or not. Okay. And if you don't need medicine, we will say you don't need medicine. Why I'm saying this is, the lot of these reversal people who have come, they are not doctors, they are not scientists, they are pure commercial people. Maybe they are software engineers, or they've got some formula, some medicine, something they've bought, some special diet from here, and something else they've bought something. They've raised a lot of private equity money, and then they come in and then they say, we will get rid of your diabetes. We will do this. All diabetologists are bad because they're giving you tablet. If you take tablet, you will get complication. If you take tablet, you will get this. They are brainwashing you. So what do? You got a fear. Oh, if I take tablet, I'll get thing. Okay, and they are promising you the heaven and earth on. They'll give it to you in your hand itself. Okay, and they're saying, oh, we will make you normal, and then you can take gulab jamun, and then you can take things. So it's like paradise. You're thinking you're in heaven, and you can get paradise. Okay, so you follow them for 2 months. They'll give you all kinds of tricks they'll do and make your thing normal. So you believe you're totally cured and so on. After 3 months, 6 months, you'll find your sugar is much higher than what you had earlier. Okay. And now if you take the same tablet, doesn't even work. You lost the opportunity. Okay. So what happens is that you'll now taking double tablet, or you end on insulin, or you end on something else because you wasted time trying some funny, untested kind of thing. Don't fall into these traps, because these are not scientists. They're not even doctors. They're not even qualified doctors. Okay, they're doing some quacks who have got some money, and they've got some. They say they've got some magic formula which God gave it in their ear secretly to them, with which they can control their diabetes. So they are doing all that. That after 3 or 4 years, they'll make enough money. They'll quit and they'll start some other cancer treatment. They'll start now. So like this, there are people who are doing all this. So don't fall into that trap. Follow the general path which people have, scientists have studied all over the world, what is accepted as scientific, helping you to have a long and healthy life despite diabetes. Remember, your goal is what is written here: to have a diabetes complications free world, not to have a world without diabetes. Not going to happen, not in your lifetime, my lifetime, in our grandchildren's lifetime also. It's not going to happen, because diabetes, due to age itself, you will get, due to long life that you're living, your lifespan itself, life expectancy, as it goes up, you'll get little diabetes and you'll get little blood pressure. That is quite normal. So you cannot get rid of diabetes completely. What you can do is to keep your diabetes under good control. So don't worry about taking tablets. And if your tablets are not needed, it's not like a sentence we are writing, okay, next 50 years you'll be on this tablet. Not at all. Next 2 months you're on this tablet. Then we'll review and we'll discuss with you. I'm not a dictator sitting and saying, okay, I'm passing the sentence on you and you will now take it. I'm going to discuss with you. How do you feel? Is the tablet suited you? Shall we continue this, or shall we reduce it? Shall we this thing? We're going to check whether you're getting low sugars to reduce it, whether you've lost weight. If you lose weight, 5 kilos, 10 kilos, 15 kilos, you've got a lot of weight to lose. The correct thing is to reduce weight. When you reduce weight, you can knock off all the medicines. I'll give you an example. Suppose your leg has fracture, okay, and now you should not put the weight on the leg, because the fractured leg, you're trying to put it together, it will break again. So what they'll say, use crutches or use a walker. Don't put weight on that leg, they say. Suppose you say, no, if I do that, throughout life I'll be using walker. Oh, foolish. If you are not doing it, your leg will break again. We are saying for 2 months, 3 months, you use that crutch. And then till your leg becomes strong, then you throw away your crutch, and then you can walk on your own. You can run also, you can run marathon also. So like that, if tablets are needed for some time, don't hesitate to use it. Let's take the next question. What is ketoacidosis? And Rajwant Kaur is asking, what is ketoacidosis and why and how it happens? Ketoacidosis means keto and acidosis. Ketosis occurs, that means the fat is breaking down into ketones and you will find ketones there. Acidosis means your blood itself has become acidic. Okay, so ketoacidosis is a dangerous condition, usually occurs in type 1 diabetes, can occur in type 2 diabetes also. It's a stage before coma. Okay, high sugars, so sugar has gone from 300, 400, 500, 600, 800, and at that time you're becoming giddy and you're almost going into a coma. That is a stage, diabetic ketoacidosis. In children with type 1 diabetes, what I told you was that if you stop your insulin, you will develop diabetic ketoacidosis. That's how they used to die earlier. Okay. Now, if you take insulin properly, you can prevent that. Type 2 also, don't think they will not develop ketoacidosis. If they have a heart attack, if they have infection, if they have something else, if they miss their medicines, if they do everything, they can also develop diabetic ketoacidosis. Can diabetic ketoacidosis be treated? Of course, it can be treated. We can pull you out of diabetic ketoacidosis. We can make you normal also. But you should never develop ketoacidosis. You have neglected diabetes so much that you have landed in diabetic ketoacidosis. So diabetic ketoacidosis should be prevented. Just like we're saying diabetes complications free. Now ketoacidosis is a complication of diabetes. We are saying complications free. That means no more ketoacidosis. No ketoacidosis in India. We should be able to say In India, last 5 years, 2 years, we've not had a single case of diabetic ketoacidosis. Everybody has managed it well. There's no more ketoacidosis in India. We should be able to say, like saying there's no smallpox, okay, no COVID in India, all gone. Like that, we should be able to get diabetes complications free. Let's take the next question. What is the reason for sudden sweating? Kameshwari, the reason for sudden sweating in a diabetic can be anything. Even if you just get excited, you'll start sweating, isn't it? You get fear, tension, you'll start sweating. If it's very hot, you'll start sweating. The AC is not working, you'll start sweating. But in a person with diabetes, it usually means that the sugar could have dropped. Suddenly, the sugar dropped from 400 to 80 or 50. It dropped. Then sweating, tremors, palpitation, giddiness, hunger, and nervousness, all these things are symptoms of low sugar. So when you are sweating suddenly, when you're not expecting it, not in a hot summer you go and you sweat and you're walking, that is normal. But suppose you're suddenly sweating in an AC room, then you check your sugar. My sugar is 40. Oh my God, I better eat something, eat sugar, eat sweet. And then next day onwards, reduce the dose of your medicine. Your medicine is too much. That's why you're developing that. So sweating can be a sign of low sugar. Okay, so you remember that, and you can prevent this low sugar from occurring. But sweating need not be only low sugar. It can be a heart attack. If you're having sweating and some chest pain, it can be a heart attack. So in a diabetic, first check the sugar. If it is low, you know it is due to thing you eat it. If it is not low, then ask yourself, why am I sweating like this? Is there something else? Should I tell the doctor? Should I inform the doctor? And should I get admitted? Should I do anything? If you have any other symptoms, you're feeling giddy, you're having chest pain, don't wait. Go straight to the doctor. It may be life-saving. We talk about the golden 30-minute period. If in that 30 minutes, if you're in the hospital, you don't have to worry. Even if you're having a heart attack, we can save you. Whereas if you delay, then the heart attack spreads and a lot of the heart is dead. And that's what we call as an infarction, myocardial infarction. So be careful. It may not be anything. It may be just a normal sweating which may go away, but never neglect your symptoms. Next question. How to avoid leg cramps? Again, Kameshwari. How to avoid leg cramps at night? Cramps is very, very common. Okay. And usually it comes at night. You're right. Normally it comes at night. Now, one of the reasons why the leg cramps comes is because of cold. You may be in an AC room, and then you will start suddenly the muscle, the muscle of the leg, the calf muscle, that gets twisted and severe pain will come. So that is a classical, what we call as cramp. Okay. That cramp can come due to cold. So if you wear socks in the night, especially long socks which goes up to your knee, you can prevent it. Second is cover yourself. Even fan can produce, not only AC, fan also. If it is continuously fan, as you're lying under the fan and that air is coming on your calf muscles, it can produce cramps. Third reason is salt being low. If you're not drinking enough water, you can get cramps. If you're not having sodium enough in your body, you can get cramps. There is one thing which we have found, magnesium. If you have very low magnesium level, it can you can develop cramps. So I've seen that when you give magnesium to people at night, 1 tablet of magnesium, then the cramps can be prevented. But very often we don't know what is the cause of cramps. So we must find out, do these simple things first. Keep your leg warm under a blanket or something. And most cases, the cramps can be prevented. Sometimes the cramps can be due to something else, diabetic neuropathy or some muscle problem or some other neurological problem. So if it is giving you a lot of trouble, please meet the doctor and we'll try to find out what is producing your cramps. Next question. Usha Kumar. Doctor, please give a talk on protein leak. Okay, that's a good thing. Protein leak. How does protein leak in the urine? Now, normally what happens is from the kidney, the glucose goes through the blood to the kidney. Protein also circulates in the blood and it will go to the kidney. The kidney is there. From the kidney, the urine is going to come into the bladder and then through the urethra, it comes out, isn't it? When it goes to the kidney will filter and it will filter and it will absorb all the protein back, all the glucose back, everything it will filter. Whatever is waste product, urea and things it doesn't need, it will throw into the urine, and through that it will come out. The reason the kidney is there, it's like a filter. So you have a tea filter, okay? You have tea leaves in it or tea powder in it. When you pour it in that, what does the filter do? It'll keep all the tea leaves there, allow the water with the tea to come out, and that's what you drink as tea, isn't it? Because you don't want all the leaves to go into your mouth. So it'll act as a filter, remove it, and then you get the tea or your coffee, and then the decoction or whatever. Then you add milk, and then or without milk, and then you can drink it. Now the kidney works exactly like that. All the things will come into the kidney, all the good things it will take out and then keep back in the body. The bad things what need to go out, excreta, just like our motion comes out through the intestine, what we don't need through the large intestine rectum, when you go to the toilet, that goes off. Similarly in the urine, all this will go. Now suppose the kidney is damaged, okay, there is a leak, the kidney is tight like that, okay, through that nothing can come. Now suppose it is like this, can you see my fingers? There are gaps between the fingers. So what will happen now? If I put like this, even water may not come through that, isn't it? If I pour water through this, nothing will come because it is so tight. Suppose it's like this, there is a lot of gaps now. What will happen? Through that everything will start going. So in the urine, when you collect it, you will find protein coming. That protein is very much needed for you. It's going to give you muscle power. It's going to give you what you're eating, the protein. It has to stay in your body to give you energy, to give you muscle, to give you various other things in the body to build up. Now that is getting lost in the urine. It is going, okay? Initially, small quantities will come. And most of it is what is called as albumin. So we call it as microalbumin, small quantities of, say the normal value is 5 milligram, okay, in the urine. It will become 30, 40, 50, 80, 100, 200. That is all microalbuminuria. Once it crosses 300, 500, 1000 milligrams is coming out in the urine, it is macroalbuminuria or proteinuria, we call it. That is the protein leak that you talked about. So once that is detected, of course, it can be also due to some urinary infection or something else, which if you treat, it may go off. But if it is persistent, you have seen it this time, next month you come for checkup, again it's increasing. That means your diabetes started affecting the kidney. You're developing diabetic kidney disease, DKD, also earlier called as diabetic nephropathy. That's exactly, again, I'm saying prevention of complication, prevention of complication. What am I talking about? Mainly about kidney only I'm talking about, kidney only I'm talking about. So if you keep your sugar under that A, B, C, D, I told you, A1C, blood pressure, cholesterol, discipline, if you do all that, diabetic kidney disease will not be there. You can test your kidney urine after 5 years, 10 years, 20 years, there'll be no protein leak at all, no albumin at all. That means your kidney is protected. This is what you do when you come to centers like ours. What do? We do all this. We'll measure microalbuminuria. We'll measure your blood pressure. We'll measure your kidney is working properly. Now we'll check your liver also. Eye will check. Nerves will check. Everything will check. And we'll see whether any early changes are there due to diabetes. If those early changes are there, we'll reverse it. Okay, there are medicines to reverse it. Even for kidney, even for that leaking of the protein, we have medicines. So we'll give that medicine, it'll reverse. Maybe after that, we can stop the medicine also. Okay, but if you don't come for the checkup, okay, now you're having only microalbuminuria, 30 only, 35. Tomorrow it becomes 50. You still don't know after 3 months. After 6 months, it will become 300. You still didn't come. 1 year, it's become 800. You still didn't come. You came after 3-4 years because you think when we ask you to come, simply to make some money, they're calling us, that's the impression which social media create. Don't believe all these doctors. They're all crooks, Don't call them. They will only call you to kill you, or they'll only call you to fleece you. That is what thing. We didn't take up, dear listeners and readers and listeners who are listening. We didn't become doctors to cheat you. We didn't become doctors to harm you. We became doctors to treat you, to help you, because we think it's a noble profession. Okay. So whatever people may say about us, there are good people also in this profession. We are here, we are spending, why I'm sitting and talking to you today. I could have been watching something else, watching a movie or watching a World Cup match or something. Why I'm talking to you? Because I want you to be healthy. My dream is to make India diabetes free, complication free, and to make the world complication free. That is why I'm talking to you. Okay, that's why we're telling you scientific facts. Every point I'm telling you today is based on published research, scientifically proven research, which anyone in the world will accept. Not one controversial thing I've told you today. Everything I told you is gospel truth. Okay, so if you pick up that microalbuminuria early, we can reverse it. So that is why you have to come for checkup, and the A, B, C, D, if you follow, then you can prevent it. Now the next stage after the protein leak, that is the early stage. First, microalbuminuria stage 1. Stage 0 is where there's no disease. Stage 1 is microalbuminuria. Stage 2 is proteinuria, massive proteinuria. Stage 3 is when your serum creatinine starts going up or your blood urea goes up. There's another way of calculating that. We call it as EGFR, estimated glomerular filtration rate, EGFR. So when the creatinine goes up, GFR will go down. It's an opposite thing. So normal EGFR is above 60, 70, 80, 90, it's normal. Suppose below 60, early kidney damage has started. Or your creatinine is up to 1, it is normal. But creatinine become 1.2, 1.4, 1.6 is going up. Then your EGFR will go down 60, 50, 40. Then kidney failure is setting in. In early stages, that is also reversible. Today, we have got fantastic tablets to reverse the kidney even after the creatinine has started going up, even after the EGFR has started going down. But at that stage also, you don't control. Then creatinine goes very high, EGFR goes below 20, 15, it reaches 10, then you need dialysis. That is a stage when you need dialysis. Or you need a transplantation. You need to put a new kidney. If you don't do dialysis or transplantation, after reaching end stage renal disease, when your creatinine is 8, 10, and your EGFR is only 10 or 12 or something, you'll die. Definitely you'll die. Because there's only 2 treatments today for when the EGFR goes down. Either a transplant or you have to do dialysis. Dialysis is lifelong. Transplant, even after transplant, you have to get a kidney, it's costly, and then lifelong you have to take immunosuppressive drugs. They're like taking cancer chemotherapy drugs throughout your life. If you stop it, the kidney will reject. So these are not easy things to do. They are not pleasant things to do. They are not cheap to do. They are very, very, very costly. That is why when somebody says, oh, treating diabetes is costly, I completely disagree with that. I'll say not treating diabetes is costly. You'll say, how, doctor? You're taking this one, you're taking medicine, you're taking checkup, this thing. How can you say it's not costly? It's not costly because if you take that, you can prevent further expenditure later on. Let's say you're spending 5,000 rupees every year or 10,000 rupees every year. Okay, 10,000 rupees every year, 1,000 rupees per month I have to send. Yes, spend it. If you don't do that, you will be spending 2 lakhs every month for kidney treatment, and that too only to keep you alive. By the time your kidney is gone, eye would have gone, heart would have been affected, your quality of life is gone. You're not even sure how much you live. You don't feel energetic. You're always down. You're depressed because you're going for dialysis. You're going for this. You're going for that, and you're spending 2 lakhs per month. If you stop it, you'll die also. Okay, I'm not exaggerating. This is exactly what happens. But if you tell people, if you spend now, you can prevent all that, they're not willing to do. When it comes, we'll see. Why should we do it now? They say. That's a very foolish thing. It's like taking insurance for a car. Now, let's say you bought a nice Toyota car. Okay. Then the man tells you, okay, sir, you also have to pay another 20,000 for insurance. No. It's too costly. I won't pay 20,000 for the car. I'll go without insurance. Sir, without insurance, you cannot take a car, sir. No. I will not pay. I'll pay 20 lakhs for my car, but I won't spend 20,000 for insurance. Waste. All these insurance fellows making money. Okay. You buy the car, and with you refused insurance, you come out of the car, immediately you have an accident. Bulb is smashed, one side of thing. You have to spend 3 lakhs now. Okay. Because you didn't take insurance, you have to spend 3 lakhs. Suppose you had paid the 20,000, you don't have to spend anything. Insurance will pay for you for the thing, isn't it? So like that, going for the checkup and keeping the sugar under control, treating diabetes is not costly. Not treating diabetes is very, very, very costly. And it's also very painful. You later on say, why I should have done all this 15 years earlier. In fact, some people have said, because my earlier doctor did not emphasize and tell me, I neglected. If he had only emphasized me and frightened me a little bit, I would have been a little more. He didn't tell me that all this will happen. I said, unfortunate. Now what has happened? Now we'll try to do. Okay. Next question. Suresh Sharma, kindly advise me about milk and diabetes. Can we have milk or not? Okay. So here is another myth that especially in Western India, Maharashtra, Gujarat, there are a group of people there and some other parts also where they say diabetes is due to milk. If you stop milk, diabetes will go away. Okay. How foolish. Milk has been there for last what 5,000, 10,000 years from Lord Krishna's time. Butter, milk has all been there. Now we have done a lot of research on dairy and milk and its connection to diabetes. About 10-15 years ago, we first noticed that among milk drinkers, diabetes is a little less. So first we thought maybe some statistical problem or something. Then we started researching it properly. And we studied people who are taking milk for 15 years, 20 years. People are not at all taking dairy, any dairy, no yogurt, no milk, no curd, nothing for 10, 15 years. And we saw how many people developed diabetes among those dairy users and non-dairy users. We were very surprised. We found that those who took the dairy, there was less diabetes. Okay, very much less diabetes. Not only that, less blood pressure, less obesity, less abdominal obesity, less diabetes, less heart disease. Then we followed them for another 5-10 years. And we found that those who took dairy actually lived longer. The death rates was less. Their mortality was less. So milk is given by God as a panacea. It's actually like amridam. Okay. So, but there is a quantity limit. You cannot take 5 glasses of milk every day. 1 glass of milk every day. It's very good for pregnant women. It's good for children. It's good for adults. It's good for everything. If you take too much of milk, then you'll get all kinds of other proteins in the body and all that, and it may not be good. But 1 glass of milk, or at least yogurt, if you can take curd, yogurt every day in your meal, it's actually protecting you from getting diabetes and protecting you from getting complications, especially heart complications, including some cancers and all. It can protect you again. So milk and dairy are actually good for you, and please don't hesitate to take it. It's a wholesome food. It gives you carbohydrate, protein, fat, minerals, vitamins. It gives you everything, but have small quantity. 1 glass of milk you can have every day, or you take yogurt. Next. Shubha Rajagopal. Hi Shubha. I recently saw about LADA. I'm type 2. Will I eventually become LADA? Shubha. So Shubha, type 2 and LADA are very different. Okay. LADA is actually type 1. It is not type 2. It's a variant of type 1. Now, when you get it in children, we call it as type 1. When you get it in adults, we don't call it as type 1. You can get classical type 1 in adults also. But if it's a little atypical form, for 6 months, 1 year, you respond to tablets. And then all tablets fail. And you need insulin. Without insulin, you cannot control at all. That is LADA, latent autoimmune diabetes of adults. LADA. Latent means hidden. You think it's type 2, but it's hidden. Autoimmune. If you do GAD antibody test, it will come positive, which is what type 1s have. Type 2s don't have GAD antibody. So latent autoimmune diabetes of adults. So that is LADA. So people with LADA, first 6 months to 1 year, maximum 2 years, they'll respond to tablet. Then it will completely stop. No tablet will work. You can give them 8 tablets. It will not work. You'll start developing ketosis, ketoacidosis, and then you'll need HbA1c will go very high. The moment you give insulin, it will respond. That is LADA. Now, how many people with type 2 will develop LADA? Type 2 will not develop LADA. Type 2 is type 2, LADA is LADA. Okay. If you got LADA, then within the first 6 months to 1 year, you should have needed insulin, and lifelong you should have needed insulin. Then it is LADA. If it is LADA, so what? You take the insulin, you'll be fine. Not that LADA is any worse than type 2, except that type 2 can be controlled with diet, exercise, weight reduction, reversal is possible. You can take tablets and control. You may not need insulin in your lifetime, whereas LADA may need insulin. LADA is little milder than the classical type 1. So don't worry, even if you have LADA, we'll take care of it and we'll make sure that you're all right. But not type 2 will not become LADA. After 2 years, you'll become LADA. After 5 years, you'll become LADA. It's not like that. LADA, you will have a different genetic thing. It's a different type of progression. And very quickly, you'll need insulin. Within the first 6 months to 1 year itself, you'll need insulin. Any other questions? Okay, somebody in Telugu, I think. Sir, the sugar is more than 250 due to heavy food intake. Occasionally, maintain HbA1c less than 7.5. Momentary shoot up of blood sugars are acceptable. First of all, 7.5 is not acceptable. Okay, so if the sugars are going up now and then, and your HbA1c is 7.5, then it is not acceptable. I'll give you another example. Now, suppose a child is in a school. Okay, now it is studying in 12th standard and it's going to write the NEET exam. Okay, and you have to get 98, 99% or more for you to get into medicine. NEET you want to study, or JEE you want to study to get into IIT or engineering or whatever. Okay, now suppose you say it's okay. I mean, occasionally in the NEET exam, if I get 30% also, give me medicine seat, no? Because I normally study well, but in that NEET exam, in that final exam, I got only 40% mark. So please give me medical seat. Will anybody give you? I say, sorry, sir. You should have got, for that you should have taken all the coaching, or you should have done everything. And in the NEET, you should have got the mark. We go only by mark cut point. We don't do anything. Similarly, if you keep saying, see, 7.5 is okay and 8 is also okay, 8.5 is okay. Sometimes I take sugar, it goes up 250, 300, it goes up. But it's okay, no? It's not okay, because your complications depend on that value. I told you HbA1c 7 or below, you don't develop complications. 7.5, you already added the risk, okay, of developing complication. Or I'll give another example. I know smoking is bad, but I smoke only 5 cigarettes, 5 to 10 I smoke. I don't smoke 100 cigarettes a day. 5 to 10 only I smoke. Yeah, your poison going into the body is a little less only, but it's still poison only, no? So like that, I think making compromises and saying, occasionally my sugar goes up, so it is okay. You are telling yourself it is okay. The body may not say it's okay. Your kidney may not say it's okay. Or your eye may not. It's not my kidney, my body. It's your kidney, your body. Okay. How much risk you want to take for it is what we have to see. So when you keep a goal 7%, try to get that goal. Now, is it 7% for everyone? No, it's not 7% for everyone. Why? Because suppose you're 80 years old, you already had a heart attack, you had a stroke, you had something else. Then we may say even 7.5 is good, 8% is good. Even then we won't say 12% is good, but we'll say 7.5 is okay. For your age, it is okay. We call it as de-intensification of treatment. If I find 80, 90, I find something the other extreme also. 90-year-old man will come, okay, and his HbA1c will be 6.3. He'll say, but I want to bring it to 5.6. Sir, please don't do it, because if you try to do it, you get one low sugar and get heart attack and you can die. Okay, so please don't do it. Please increase it. Make it 6.5. Make it 7. Also, that is safer for you. We do both. For there, we have to tighten up the control. We do that. Where we tell them to loosen up the control, that also we do. Okay, so both of these we have to do. That is what again, I'm coming back to personalized diabetes care. Precision diabetes care. It is not one size fits all. I always joke and say, if it is so easy, like some of these fellows, commercial wallas do, if it is so easy to treat diabetes, why I spend 50 years studying all this? I can train my Gurkha when he comes there, no, sir. When he comes, you give him this potlam, one medicine you give him, and give him one diet sheet and send him off. From the gate itself, he can go. Gurkha can treat diabetes. Okay. So it is not like that, isn't it? We have to study with our experience, years of experience. We say, oh, this person we can treat this much. That person we should not treat this much. Oh, this is a LADA. This is a type 2. This is an FCPD type of diabetes. This is a gestational diabetes. This is this. This is that. Within diabetes itself, there is so much to learn that at the end of 50 years of working in this field, I feel there's so much to learn. I have not finished. I need another 50 years to know a little bit more about that. Unfortunately, I may not get another 50 years. But another 50 years, if I have, maybe I'll be able to learn more about diabetes. 50 years has not been enough for me to learn diabetes. There's so much to learn about this one disease. Okay, next. Najia Sherin. Can a diabetic patient varicose veins experience severe complication? Are the two conditions connected? Not directly, Najia. So varicose veins usually comes when your veins become a little stretched out, especially in the legs, and prolonged standing is one. You're a teacher, you're a police officer, you're on the street, or you're standing all the time. They're the people who normally get it. Sometimes due to age, your muscles and your tissues become a little loose, and therefore the veins also get stretched out, and then you get varicose veins. Varicose veins is not directly due to diabetes. Will form that can lead to gangrene. So in a person with diabetes, don't neglect the varicose veins. Go and look after it. But diabetes didn't produce the varicose veins. Nor did varicose veins have a direct relationship with diabetes. Do you have any other question? I know that we have finished 1 hour, so I'll probably take last one or two and finish. Saurabh Shankla. If my weight loss, if I lose my weight and reverse my diabetes and maintain that weight, can I eat like a normal person? Well, it depends on the condition that you have and how much diabetes you had and how you reversed and how many kg you reduced in weight. I'll give you an example. Let's say you are 90 kg in weight, okay, and your ideal body weight should be 70. Now you have brought it to 70 by cutting calories. Without cutting calories, you're not going to lose weight. So you cut calories, you started exercising, you're very regular, you wanted to from 90, 85, 80, 75, 70, you have reached. With that, your HbA1c, which was 8, has become 5.5 now. It's become completely normal. You're completely gone. You're now under very good control. You have achieved everything, ideal body weight, everything. Now, what you're saying is, I'm now normal. So let me eat everything that I wanted. So, see, you're asking like a normal person, even a so-called normal within inverted commas person cannot eat whatever they want. They cannot eat ad lib. I can eat one whole anda full of biryani. I can eat, and I can eat one whole, Kesi Das Rasgulla. There are 25 Rasgullas in that. I'll finish that whole thing. That person will not be normal even if he's not diabetic. If he eats like that many calories and that many thing, if you eat, they will put on weight, they'll bloat, their liver will become fatty, they will become thing, they'll become blood pressure will go up, sugar will go up, triglyceride will go up, fat will get into the arteries, heart, all sorts of things will happen even if you don't have diabetes. Okay, so the so-called what normal person eats, normal person also should be eating like a person with diabetes only. More vegetables, some fruit, cut down carbohydrate, take healthy fats, okay, take protein that is needed for you. That is what a diabetic person should eat, and that's what a non-diabetic also should eat. So the so-called myth, this is what the reversal walas are telling you. Once you reach that, you are in paradise now. Okay, we will give you tons and tons of biryani. You can eat whatever you want. We'll buy you all the sweets that we can get. Diwali now sweets are coming. We'll get you from Calcutta. We'll get you from Gujarat. We'll get you from, Tirunelveli halwa. We'll get you everything, and you can enjoy whatever you want. That is a picture that they're painting. They may not tell you in those words, but that is what they're making you believe. Don't believe that, because you will never be able to do that. The moment you do that, all that you achieved will go off. Your 70 kilos will become 75, 75 will become 80, 80 will become 85, 80 will become 90. And your sugar, your HbA1c could have been 9 earlier. Now it will go to 14. Okay, all that you did becomes waste. And what happens, because you went from there to there and from there to there and from there to there, it's like a plane going. See, if a plane lands slowly, it's okay. The plane goes like this, what will happen? Suppose a plane pilot is taking you up down, you'll all vomit and you'll all become giddy and you may even die, isn't it, if you do that? Similarly, where sugar goes up down like that, every 3 months it's up, then it's down, then it's up, then down, your body will get totally confused. Your body's whole rhythm will go. So don't do all that. Go slow, steady. Okay, from 90 I reached 85. Good, celebrate it. Okay, 85 to 80. Good, you've reached that. Don't think you're aiming for that 70 to do all the things that you have done to regain everything. That is a false impression that you're having. Okay, once you've done that, I can do whatever I want. It's like a student saying, same NEET exam will take. Fellow has passed. He's got 99. He's got into medicine. Now I got into medicine. So therefore, I don't have to study at all. I have achieved everything. Okay. Now in medicine, I will not touch my books. I will not do anything. I will not study. You will fail, 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 fail. You'll never become a doctor in your life. Okay. Having or JE, you've gone to IIT now. You joined IIT. Now I can relax. I'm not going to study. I'm going to watch only cricket and Netflix for the rest of my life and have a beer every day. Okay. You will lie there itself. In that first year itself, you will lie. You'll never become a doctor. You'll never become an engineer. Never become IIT. You'll never become. If you have studied that hard to get into medicine and IIT or whatever, you better continue like that throughout that course also. Okay. It's not that after having gotten now you can give up everything. So that's the same philosophy that you're saying, that once I reach the thing, I can give up everything. Don't think like that. If somebody tells you like that, they're just playing the fool with you. Okay. Okay, I think we are now 5 minutes ahead. This is going to be the last question. So Rakesh Sharma, I'm having diabetes. Any relationship between diabetes and urinary infection, balanitis, or yellow-brown urine? I don't know what you mean by yellow-brown urine, because urine is always yellow only. But the other two you said, yeah, the balanitis and the urinary infection, 100% correlation with diabetes. If you get balanitis, balanitis means on the tip of the penis, you get infection, or in the genital tract of women also, there you get redness, itching, fungus infection, white discharge coming in a lady. All that means that your sugar is not under control. Okay. You can also get it due to some medicines and so on. If that's so, you should stop the medicine. The SGLT2 group of drugs produce that. If that is so, you might have to stop it. But now, having got that, it means your sugar is high. I can guarantee your blood sugar is more than 200, 250. HbA1c must be 8 or 9. Otherwise, you cannot get it. Okay. So once you control your sugar, you will find that the balanitis goes away. Just putting some fungus cream in that and keeping your sugar high will not solve it. So there is 100% correlation between balanitis, urinary infection, and diabetes. So, and if you control diabetes, all these are very easily controllable. So when I talk about complications, I can divide it into two: acute complications like balanitis and so on, or urinary infection. These are acute complications, come next day itself. Then there are chronic complications because blood vessels are getting affected. Blood vessels in the eye, kidney, heart, feet, nerves. Those are chronic complications. They take time. Acute complications come within 1 week. That can take 3 months, 6 months, 1 year, 5 years, 10 years. The chronic complications, once they come, you may not be able to reverse it. Acute complications you can prevent. Even ketoacidosis is an acute complication. Hypoglycemia is an acute complication. Urinary infection is acute complication. All that you can treat. But once the chronic complications come, then you cannot treat it at all. I know that it's been a long time, and 1 hour and 7 minutes I've been talking. I hope I have given you all an idea about what is diabetes, different types of diabetes, need for checkup, need for having a practical approach to diabetes, not being hoodwinked by people who promise you the earth and the moon and the stars and everything, and telling you that taking proper treatment is wrong and only curing diabetes is possible. All these are distant dreams, which in 5%, 2% of people it's possible. The rest of you, keep your sugars under good control. And as I said, our dream is to have a diabetes complications free. You must be free of complications. Your family members must be all free of diabetes complications. And let's make a diabetes complications free India, and then a diabetes complications free world. That is my dream. That is my message to you for World Diabetes Day. If you need any help with us at any time, please reach out to us. Our details are given there. Our email IDs are given. Our cell phone numbers are given. And anything you need, please reach out to us. Our email ID also will now show it now. Phone numbers are also there. Never hesitate to contact us for anything that you need. Let me end by wishing all of you a very happy World Diabetes Day. Let me pray that you and your family are blessed with good life, with good health, and that you continue to live to 100 years of age without any complications of diabetes. This thing is also given there, contact@drmohans.com. Not just for appointments, but if you need any other doubts which we could not take up here for lack of time. Let me also tell you that throughout this week and throughout this month, going up to World Diabetes Day and beyond, many of my doctors, we have got about 80, 100 doctors, diabetologists working in our system. Every one of them in different languages will be reaching out to you. Tamil, Telugu, Kannada, Odia, Bengali, Hindi, English, everything will be reaching out to you, giving you similar messages, probably different things. All of you can stay in touch, ask them questions. I'll also come back to you later on another event. And I hope this was useful to you. And if it is useful to you, please leave your comments, suggestions, anything else that you want. Please subscribe to my channels, my YouTube channel, Dr. V Mohan. If you just type, you will get Dr. V Mohan Diabetes or Dr. V Mohan, you type, you will get my YouTube video. There are more than 200 videos are there on all aspects of diabetes that you need to know. You can find it there. You will also find that we are there in Twitter, now called as X. We are there in Facebook. We are there in Instagram. We are there in LinkedIn. Whatever source, whichever part you are, whichever you have subscribed to, whichever social media, we are there for you. You will find that there are separate channels in our hospital's name. There are separate channels in my personal name, Dr. V Mohan. Many of you may be already following me, but if you're not following, please follow us, because you'll get many such useful information. You found that this today's program was useful to you. You will get many more such tips and so on. So let me end once again by wishing you all the very best. God bless you. Goodbye and namaste. Thank you for watching.